Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Common types of nasal sprays and how to use them. Nasal sprays can treat congestion and other symptoms of seasonal allergies or a cold. They work by delivering a fine mist of medication into your nostrils. Since the lining of your nose is rich with vessels and can easily absorb medications into your bloodstream, nasal sprays can also end up delivering medications to other parts of your body. /r/n/r/n nasal sprays are available by prescription or over-the-counter, OTC. Most products come in a hand-operated pump bottle or squeeze bottle. Knowing how to use a nasal spray is important, as doing it incorrectly could affect the dose you receive. /r/n/r/n There are many OTC and prescription nasal sprays to choose from. OTC nasal sprays for congestion and allergies are popular products at pharmacies, groceries, and other retailers. /r/n/r/n There are also other nasal sprays that deliver vaccines to prevent illness or medication to help manage it. /r/n/r/n There are three main types of nasal sprays. /r/n/r/n If you have COVID-19 and have nasal symptoms like congestion and sneezing, you might wonder if a medicated nasal spray would be helpful. Researchers are still looking into this and whether these sprays are safe for people with COVID. /r/n/r/n One study in 2021 found that people who were already using steroid nasal sprays before they got COVID didn't get as sick as people who weren't using them. However, the researchers did not think there was enough evidence to support nasal sprays as a treatment for COVID or as a way to prevent COVID. /r/n/r/n If you have COVID and are looking for relief from nasal congestion and other symptoms, ask your provider if you can use an OTC nasal spray or if they can prescribe one for you. /r/n/r/n Instructions on how to use a nasal spray differ somewhat depending on the type of spray. If you don't understand the instructions for the product you're using, ask your pharmacist to walk you through them. /r/n/r/n Before using a nasal spray, /r/n/r/n Here are the steps for using a pump bottle nasal spray correctly. /r/n/r/n If you're using a nasal spray the right way, the medication should not drip down your nose or the back of your throat. However, some nasal sprays may leave an unpleasant taste in your mouth. A drink of water or juice should help clear the aftertaste. /r/n/r/n Never use a nasal spray after the expiration date on the bottle. Liquid medication can easily be contaminated with dirt or bacteria. /r/n/r/n Nasal sprays can cause side effects. Common side effects of nasal sprays include /r/n/r/n If mild side effects don't go away or get worse, or if you have any of the following serious side effects, call your provider. /r/n/r/n If you are pregnant or breastfeeding, ask your provider before using nasal sprayeven one that's OTC. /r/n/r/n There have not been specific studies on using OTC nasal spray products such as Afrin in people who are pregnant or breastfeeding. However, the product labels usually include warnings for people in these groups just to be safe. /r/n/r/n Nasal sprays cause the blood vessels in your nasal passages to narrow, which can make your blood pressure go up. This is usually not a concern if you have normal blood pressure. If your blood pressure is typically high, ask your provider before using any nasal spray. /r/n/r/n Lindner Verywellrnrn Do not use a decongestant nasal spray for more than 3 days without talking to your healthcare provider. Overusing nasal sprays makes them less effective and may even make your symptoms worse. This is called rhinitis medicamentosa or rebound congestion. /r/n/r/n The narrowing of blood vessels in the nasal tissues, vasoconstriction, helps decrease congestion and fluid in the nose. This is why certain nasal sprays, like Afrin and Neo-Synephrine, make these symptoms better. /r/n/r/n However, if you use nasal sprays too often or for a long time, they will stop working and you will need to use more to get relief. If you overuse nasal sprays, you might need a metered dose device called a rhinistat to wean you off the medication. /r/n/r/n Using nasal spray too much or for a long time may also damage the tissues of your nose, which are very delicate. In severe cases, it can cause a condition called saddle nose deformity, a collapsed nasal bridge. /r/n/r/n Overdosing on nasal spray is not common, but cases have been reported. /r/n/r/n If you use more than the recommended amount either on purpose or by accident, you may have symptoms like dizziness, chest pain, headache, and changes in your blood pressure. If this happens, you should call poison control and seek emergency care. /r/n/r/n Nasal sprays can relieve congestion and other symptoms of allergies and colds. You can get nasal sprays over the counter, OTC, or as a prescription from your provider. Some medications that come in nasal spray form, like vaccines, must be given to you by a provider. /r/n/r/n While using a nasal spray for congestion or other symptoms can be okay in the short term, if you use nasal sprays too much or for too long, they can stop working. Overusing nasal sprays can also lead to rebound congestion. /r/n/r/n If you have been using a nasal spray for 3 days and your symptoms aren't any better, they're getting worse, or you have serious side effects like trouble with your vision or dizziness, stop using the nasal spray and call your provider. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.